Control urinary incontinence naturally. Urinary incontinence is the involuntary loss of urine. This means that the individual is incapable of holding their bladder. It appears at different stages of life and is more common in women. Learn how to control it naturally in this article. Causes and types of urinary incontinence. Urinary incontinence is much more than expelling a little urine when sneezing, coughing, laughing or lifting something heavy. It's a hygienic problem that often affects the patient psychologically and reduces their quality of life. It's not a disease itself, but is the result of changes in the bladder that are common in many diseases. This problem can appear at any stage of life in both sexes. However, it occurs with greater frequency in women, especially during pregnancy and menopause. It happens when internal pressure in the bladder is greater than the urethra. The different types of urinary incontinence are: urgent incontinence. It's when the loss of urine is involuntary and is associated with the urge to urinate. It happens when the sensory impulses in the walls of the bladder don't react in time or as a result of hyperactivity in the area. Overflowing incontinence. This type of incontinence occurs when the bladder is stretched from being full of urine, either from a blockage in the urethra, benign enlargement of the prostate, in men, or neurological damage from a spinal cord injury, surgery or multiple sclerosis. Psychogenic incontinence. This is related to external sensory stimuli like cold water, strong emotions like fear or anxiety and phobias or mania. Neurological incontinence. This type is due to changes in urinary function that are caused by problems in the nervous system. It's common in those who have suffered from a stroke, Parkinson's disease, multiple sclerosis and spinal cord injuries. Home remedies for urinary incontinence. Recipe No. Ingredients: 2 tablespoons fennel, 1 cup water. Directions: boil the water with the fennel for 5 minutes, then let cool. Drink a cup a day. Recipe No. Ingredients: 1 handful raspberry leaves, 1 cup water. Directions: boil the water with the leaves for 5 minutes. Drink a cup per day. This recipe is good for those who need to strengthen their pelvic muscles. Recipe No. Ingredients: 1 garlic bulb, 1 handful white hawthorn flowers, 2 liters water. Directions: crush the garlic and make a tea with the hawthorn flowers and let brew for 15 minutes. Strain and add to a bathtub filled with warm water and take a bath. Recipe No. Ingredients: 1 tablespoon bearberry leaves, 1 liter tea. Directions: add the bearberry leaves to the tea. Drink a cup every 3 hours, no more than 5 times per day. This remedy cannot be used by those with kidney inflammation. Tips and techniques for urinary incontinence. Take warm sitz baths. Sit down. Contract your pelvic muscles and hold for 5 seconds. Relax for 10 seconds, then contract them again. Repeat this exercise 10 times a day. Do Kegel exercises. These exercises are accomplished by contracting the pubicoccygis (PC) muscle. Each time that you urinate, stop the stream by squeezing your PC muscle, then continue urinating. Do this several times until your bladder is empty. Note: you shouldn't practice with a full bladder more than 2-3 times a month. However, if you still want to do these exercises, you can do them with an empty bladder, simulating the process of urination. Hypopressure exercises. Stand with your legs hip-width apart and bring your pelvis forward. Slightly bend your knees and raise your palms. Contract your abdomen 3 times with short breaths. When you exhale, do it slowly. Completely fill your lungs. Repeat this process twice. Figure out the cause of the incontinence. If it's due to stress, nerves or urinary tract infection, you know how to take care of it. Avoid certain foods. Avoid foods like tomato sauce, chocolate, corn syrup, sugars, honey, chili pepper, curry and all other spicy foods because they can irritate the bladder. The same goes for coffee, soft drinks and tea. Don't reduce your fluid intake. This is a common mistake that many people with urinary incontinence make to keep from accidentally urinating. However, this can lead to dehydration and other serious consequences for the kidneys. Lose weight. Obesity goes hand in hand with many problems, and one of them is incontinence. When you're overweight, your muscles cannot contract properly, including the pelvis. Prevention. Before going to sleep, go to the bathroom. If you feel like coughing or sneezing or know that you have to lift something heavy, tighten your PC muscle to prevent urine from leaking out. Go to the bathroom before leaving home. Wear underwear that's easy to take off and carry an extra pair in case of accidents. Every time you go to the bathroom, try to completely empty your bladder. Try urinating even if you don't feel you have to in order to teach your body how to urinate again. Don't hold your bladder. When you feel like you have to go, go. Otherwise an infection could develop in the bladder or the sphincter muscle may weaken.